Hey everybody, soft serve gentleman, Dean Alejandro here. Thanks for tuning in today. Obviously, I am not Dean, just kidding. Now that I've taken off the hat, you know that I'm not Dean. But no, I'm Jerica Kirkley, and I'm a physician and the founder of Mariposa Health, which you might have heard Dean mention on some of his previous programs. But Mariposa Health is a virtual HRT medical service for trans folks. And I'm a trans woman myself. My pronouns are she, her, and hers. We're actually co-sponsoring this month's binder giveaway with Dean, who was very generous to let me use his platform to do a question and answer session, which was actually his idea to answer some questions about gender affirming care. So big thanks to everybody who has already downloaded our app and started to chat with us. Super cool, and I'm happy to be with you here today. Dean and I wanted to do this, well, ideally in the same space, and then together on a Zoom call. But due to some technological issues and the snowstorm that's going on outside, that's been a little challenging. So it'll just be me right now, but hopefully I will see you in future Soft Serve Gentlemen episodes with Dean. Also, just a big thanks to Dean for being an awesome person and a great support for our trans community and everything that you've done with the Soft Serve Gentlemen program and the resources that you provide. Also, a big thank you to everybody who has submitted questions for today. We'll try to get through as many as we can. If we don't get to your question, hopefully we can do this another time. And yeah, would love to keep this going. So a little bit of information about Mariposa Health and myself to get started, and then we'll dive right into the questions. So like I said, I'm a trans woman, I'm a physician. I've been practicing general practice or family medicine for the last 7 years. And throughout that time, I've always been really, really interested and passionate about gender affirming care. So basically providing medical treatment or hormones, other medications to help affirm our gender. And I've been very fortunate to do this in a few different clinical settings, but what I kept coming up against was a lot of barriers for people getting into care because they live far away, insurance issues, you know, the list goes on. Also just like trouble finding a competent provider in a safe space. So the reason that I wanted to create this was to really radicalize the way that healthcare is delivered, and in particular for trans people. And wanting to make this process as affirming, beautiful, accessible, expert level, easy, and celebratory as possible. Because this is, well, not for every trans person, but this can be a core part of who we are. And we don't want to feel like we're having to walk through a bunch of doors and go through a bunch of barriers just to be who we are. So that was the motivation for doing it. In addition to the prescribing of medications and the actual evaluations that we do, we also can provide things like letters of support for surgery, for gender marker change or name change if needed. So we are currently providing services in Colorado, California, Florida, and New York, and we hope to be expanding on a state-by-state basis as we go along. We're currently for those who are 18 years and older. And I'm a huge advocate for medical services for all trans people, regardless of your age. And I've done that in many different clinical settings. But for this service in particular, because it's a virtual online platform, it's app-based, and we're going to be scaling at a really large level across the country, there are some regulatory restrictions that come into play when we talk about consent for those under 18 and how we obtain that. So hopefully as we go along, we'll get through those barriers and be able to provide medical services for under 18 as well, but right now it is 18 and above. Without further ado, we will dive right into the questions. And again, thanks for sending these questions to us. All right, so first one, how can I start HRT? So, I mean, first and foremost, you have to find a provider that can provide the HRT for you. Easier said than done, as many of us know. Because we want to find a provider who's trusted, who's vetted in our community, and that we are comfortable is going to know how to provide these medications for our transition and do it in a competent, responsible way. So a great place to check to start out is your local LGBTQ+ center. You might not live near one, but they always have websites. You can call somebody, you can check out, usually have provider resource lists to give you an idea of where to start with. And another great resource is the WPATH Provider Directory. We'll put that link below. But this is a really cool resource from the World Professional Association of Transgender Health where you can actually go in, select your state, select your city, and even select the type of provider that you're looking for, or you can just see all providers from medical, surgical, behavioral health, case management, whatever it is you might need. They usually keep a pretty up-to-date comprehensive list. And that's a good starting point. Of course, talking to your peers, talk to people who have gone to doctors, gone to clinics, and can give some personal feedback on that. Highly encourage that. That's where you're going to get a really unbiased perspective. And so that could be talking to people by word of mouth, going into Facebook groups, Reddit forums, being careful with the information you receive there, but if it's really just getting a perspective of a clinic and how they handle things, I think it's a great place to do that. And of course, if you want to get started with us, with Mariposa, then all you have to do is text us at 720-897-3749. We'll put that information below as well. And then we'll send you a link to download our app. And then from there, you can start communicating with us in a secure app just by texting. And we'll get back to you as soon as we can. We're usually pretty responsive during business hours. And we can get that registration process started. Usually takes about 20 minutes, and we're currently offering the first month completely free. So if you have your initial consult before April 30th, then yeah, first month is free. Might be extending that in the future, so just keep tuned in and we'll let you know about updates on that. But basically at the end of that 20-minute registration, we'll send you a link to schedule your initial video visit. And then once you have that video visit, we'll send your prescriptions and you're good to go. So, next question, will HRT make me bald? Why am I losing my hair? Parentheses, FTM. Okay, so clearly this question is asking about testosterone for folks that are taking it to masculinize. And really the answer to the first question is, it depends. I know, it's a lame answer, but it's the truth. Okay, so testosterone is a driver of patterned hair loss. We know that. But the extent of which is determined by a lot of things. First and foremost, the dose that you're on, genetics, family background, is there a history of balding in your family, and some other factors as well that could be other conditions of the scalp, other medical conditions. So it really is an individualized thing. It's hard to give a blanket answer, but those are the things that we're going to look at in terms of the likelihood of hair loss. Why am I losing my hair? So as I said, testosterone is a driver of patterned hair loss. The main reason is that testosterone is converted into something called dihydrotestosterone, or DHT, in the body, and that's done by this enzyme called 5-alpha reductase. And I mentioned that because it's an important thing to know about how we treat that, how we treat hair loss. But basically, DHT is much stronger than testosterone in making masculinizing changes in the body. So this has important consequences on both masculinizing gender affirming care and feminizing gender affirming care. And in particular, DHT causes damage to the hair follicles on the scalp, which then ultimately results in hair loss. So that's just a little background on that. Third question, do you have any experience with hair restoration or terminal hair conversion regimens, i.e. Minoxidil, Nizoral, ketoconazole, azelaic acid, biotin, or tretinoin? So I am not a hair restoration expert by any means. I'm not a dermatologist, but I can give you at least an overview of the information that we know based on hair restoration experts and dermatologists, and then kind of based on some clinical practice with my own patients and of other gender affirming care providers around the country. So what we do know based on studies is that oral finasteride, or a pill you take by mouth, which is a 5-alpha reductase inhibitor, meaning that it blocks the conversion of testosterone to the stronger DHT, and Minoxidil, so there was a topical medication that you can just drop onto your scalp, seem to be where at least we have the biggest body of evidence in terms of potential for preventing hair loss based on studies that we have. So other treatments, and these are all topical as well, things that you would apply to your scalp, so like antifungals, like the Nizoral and ketoconazole, azelaic acid, tretinoin, biotin is usually a vitamin you take by mouth. We don't have certainly as big of a body of evidence to support these, although seem to be some anecdotal evidence and some smaller studies which suggest that they also help with at the very least stopping and or slowing hair loss. In terms of actual hair regeneration, that becomes really difficult to do and is really going to be individualized based on that person's genetic makeup and other things we were talking about. So actual hair regrowth really is going to happen with a hair transplant in most cases to truly regrow lost hair. But the other thing to know is a lot of these topical medications can have some irritant side effects with things like redness of the scalp, burning, flaking. So just important to be aware of. So yeah, so this is certainly I would call it fairly young field of evidence, especially in terms of gender affirming care and using testosterone for masculinizing. So I think there's some potential there. We're always willing to work with you, especially when it involves effects of the therapy that we're using to try to find some solutions. But we just don't have a ton of great evidence that these things are definitely going to work. All right, so number 4, what are your thoughts on using topical tea to strengthen tissue used for MTF SRS prior to and after op? Okay, so T being testosterone, it appears in this case, MTF, male to female, so probably a feminization surgery like vaginoplasty. SRS usually referring to sex reassignment surgery or gender affirming surgery or confirming surgery, as we say these days. So great question. I'll be completely honest with you. I have not heard of this come up. I certainly have not seen this in the literature around gender affirming surgery, in particular vaginoplasty. I've heard several talks by pretty widely renowned gender affirming surgeons and read about them as well, including folks like Marcy Bowers, Toby Meltzer, Christine McGinn. I haven't seen this. Very intriguing. If you have information about this, please post below. Would love to read about it. And I'll certainly try to reach out to these folks, these surgeons, as well as just the greater gender affirming care provider community and see what I can come up with and post on here to give you an update. What we do know, or what we do recommend prior to surgery, is hair removal. So that's super important to have permanent hair removal, and that has to be done by electrolysis. Laser does not result in permanent hair removal. But in terms of the tea, fascinating. I would like to find out some more. How often do you send your MTF patients for blood work, and what sorts of blood work do you feel is necessary at what stages? Great question. So I don't usually get blood work, and so MTF, we're talking about feminizing, using things like estradiol and other testosterone blocking agents. So I don't usually get blood work when first starting therapy, outside of a very few exceptions, which are usually like maybe some overlapping medical condition where I want to know what your labs are like because the medications you're using could affect that lab as well. But in general, usually we can just wait, and I usually get labs starting at 3 months and then get labs every 3 months after that. So this could start to be spaced out after you've been at least a year on therapy and things are really stable. But I've noticed a lot of people like that 3-month interval going forward, just because it gives them a nice framework of where they are in terms of their physical change and then what's going on biochemically in their body. And oh yeah, what do I get? So typically an estradiol and a testosterone level are the two main things that I like to see. That's really what we're going to mainly use to guide our therapy and make sure that we're keeping levels in the safe ranges to avoid potential side effects based on, again, the studies and medical evidence that we have. And then plus or minus some potassium and electrolyte monitoring and kidney function monitoring, which is done with a single test. And that's specifically if you're on a medication called spironolactone, or Spira as it's called, because it can affect your potassium levels. So last question, once you start HRT, do you need to stay on it forever? FTM and MTF and differences? Awesome question. Get this a lot. So really right now, the recommendation that is coming from pretty much all the guideline makers in gender affirming care, and I think about WPATH, I think about UCSF, Endocrine Society, what we're saying is that yes, it's important to stay on at least some form of hormone indefinitely, whether you're feminizing or masculinizing, and especially, and more specifically, if you have removed the organs which would typically produce the opposing hormone or the other sex hormone, as we refer to estrogen and testosterone. So for example, if you were assigned male at birth, you later went on estrogen for feminization therapy, and then had the organs removed that produce testosterone. So really the only effective hormone you have in your body, at least the only sex hormone, would be the estrogen. And then if later in life, if you stop the estrogen, then you wouldn't have any sex hormones in your body. Why do we worry about this? It's mainly your bones. So we know that both testosterone and estrogen are really important for bone health and prevention of osteoporosis. So we wouldn't want to put you at increased risk of osteoporosis. And so for that reason, we recommend to at least have a low dose of some hormone on. Now, if you, as you go along and you're older and you don't have that opposing hormone to cause regression of your changes, and somebody decides they just don't want to be on hormones anymore, certainly a reasonable decision. And again, we just make that shared decision based on an informed approach, knowing what risks there might be. All right, very cool. This has been a lot of fun. I hope you've enjoyed it. And if you like this video, give a thumbs up. If you have any related questions or comments on my answers, always open to feedback, so feel free to put those in the list or in the comments below. And if you want to see more videos every week, obviously please subscribe. Dean is awesome. And I'm super excited to be back on April 30th, where Dean and I, in some form, whether in the same space or not, are going to announce the binder giveaway winners. So thanks for listening, everybody. Stay safe, and we'll see you next time.